Last 14 days, we have seen cases. When you look at total over the last 14 days, they've started to decrease about 20%. We've had one death in the last 7 days from COVID-19 in Forsyth County. You can see this is looking at our lab confirmed COVID cases over the last year. When you look this from week to week, there's a little bit of an uptick here from the really the next last week in March to the last week in March. We're really not too worried about that. As you can see, we're pretty much at the lowest we've been since March of last year of 2022. So we're just paying attention to that, but no real big concerns now. We're obviously always looking at other variants. In India right now, there's XBB 1.16, so that's a variant we're looking at. But a lot of times when you see these variants, one variant will overtake the other, but the cases really don't go up that much, and then you're looking at the hospitalizations. So those are all the things, but it's not uncommon throughout this pandemic for variants to overtake other variants over time. This is my last slide. This is a brief update. We know that the federal emergency is ending on May 11th. At-home test kits, we have over 50,000 test kits in stock, and currently we're distributing over 500 at the 10 library locations. Several of the library locations said they are moving through those test kits very fast, so we're continuing to keep those restocked. We also have them here at the Health Department on Highland Avenue and at the Government Center at Chestnut. We also received in the mid-March a kiosk for COVID test kit distribution. Initially, that kit was a PCR test, so you could go up to it, get that test kit, get a sample, and then literally through a bag that was in the kit, you could put that test sample back into the machine, and it would be run by a lab, and you would get your results within a few days. So that's the PCR test. But in addition, there's an antigen test kit, which is just like our other test kits. That's at-home test kits. That's now in the machine. That change was made just yesterday. They reformatted the machine to include that. Also, we talked about vaccine commercialization. We're still waiting on specifics from the vaccine providers and those the commercialization of the vaccine. Also, we're continuing to look at some information. The World Health Organization just put out some information where they were saying that unless you were immune compromised, they were not recommending to have continued booster doses. But we're seeing what the CDC and the FDA is going to recommend here in the United States. I think, the World Health Organization is also looking at the global supply of vaccine. And while in the United States, we have an ample supply, there's been ample opportunities now for several years to get the vaccine. You have some countries where they still don't have adequate access and coverage for the vaccine. So we're, stay tuned for that as far as what we'll be seeing come to fall.